Hello and welcome to another episode of Ask the Doctor. In this episode, we sit down with Dr. Ashley Abbott, a rheumatologist with Medical Associates of North Georgia in Woodstock. Welcome in, Dr. Abbott.
Hello, my name is Dr. Ashley Abbott. I'm a rheumatologist at Northside Hospital.
What are the early signs and symptoms of an autoimmune disease, and what should I watch for?
There are a number of symptoms that you should look for. A lot of symptoms that you should be mindful of are systemic symptoms. That's when you have generalized fatigue, weight loss, as well as fever. And then as things progress, you can go on to have joint swelling and pain, rashes sometimes.
How do you differentiate between different types of arthritis, such as rheumatoid arthritis and osteoarthritis, especially when symptoms overlap?
So arthritis, I like to place into two buckets, inflammatory and non-inflammatory. Osteoarthritis falls into the non-inflammatory because your immune system, it's not actively trying to destroy or attack the joints. While rheumatoid arthritis falls into the inflammatory bucket because your immune system is actively attacking the cells in your joints. And what happens in inflammatory arthritis, you get very prominent swelling. You get lots of morning stiffness that will last over 1 hour usually. And what's unique about this arthritis is that you feel better the more you move, while the opposite happens in osteo, where the more you move and the more active you are, the worse you feel. The swelling is not as prominent, as well as the stiffness might last less than an hour.
What role does genetics play in the development of autoimmune diseases like lupus or rheumatoid arthritis?
We see that genetics plays a big role in a lot of these autoimmune diseases. There's usually a genetic predisposition that patients have, and we see that it can often sometimes run in families, particularly in your nuclear family, we find. There's a lot of twin studies that have been done to show that there's a correlation between genetics and autoimmune diseases. But genetics is not the only thing that causes it. There has to be a trigger. So there's usually a complex interplay between genetics and then your environment.
How do lifestyle factors like diet and exercise play a role in managing autoimmune diseases?
Now, lifestyle factors are very important in all chronic diseases, whether it's autoimmune, diabetes, or hypertension. I think it's great to help manage lifestyle factors because stress can be a trigger sometimes for an autoimmune flare. So, managing stress is very important. Getting adequate sleep is also important. In terms of other things that you can do is, helping with diet and exercise, which decrease inflammation overall in the body.
What are the early warning signs of disease flares in conditions like rheumatoid arthritis and lupus, and how can they be prevented and minimized?
Now, in terms of early warning signs, as stated before, usually you want to look out for systemic symptoms, particularly fever, weight loss, generalized weakness or fatigue. And sometimes you can get hair loss with that as well. And then as things go along, you can get some joint pain and swelling that's very prominent and atypical rashes.
What are some effective strategies to maintain joint mobility and flexibility, especially as we age or with disease progression?
Now, what I like to tell my patients is it's just important to move your body and do what you love, whether that's walking or biking, and try to incorporate it into your routine, whether that's daily or weekly. And it's very important to keep, mobility in those joints as much as possible. Thank you for listening. If you have any concerns for an autoimmune disease, please talk to your Northside primary care doctor. I am accepting referrals for new patients.
Thank you for watching. This has been another episode of Ask the Doctor in collaboration with our friends at Northside Hospital Cherokee. If you enjoyed this episode, please don't forget to like, share, and subscribe for future episodes. Thank you, and enjoy the day.